If we're going to seriously reach a larger number of people, then we need to explore other models.
Dr. Perry Kendall was BC's public health officer 6 years ago when the province declared a public health emergency because of toxic drug deaths, which have only grown exponentially. The government started prescribing drug alternatives in a new program last year to keep people from dying from the black market supply. Right now, a doctor can prescribe drugs to treat substance use disorders, but not clean heroin. Dr. Kendall says the program is too hard to access, and that needs to change.
It's only reaching a fraction of the people who need it. So if we look at who's dying, nearly 50% are not people who would meet the criteria of an opioid substance use disorder. I think we need a different model, a sort of public health-based model that looks at a regulated access to a wider variety of substances for more people.
He says people with lived experience using drugs want to see medical-grade heroin offered more widely. Cheyenne Johnson with the BC Centre on Substance Use says people are mostly getting opioids from the program, drugs used for treating opioid use disorders.
And the current model in British Columbia involves utilizing physicians and nurse practitioners to access pharmaceutical-grade supplies of opioids and other medications to reduce people's risk of the toxicity of the drug supply that they would be purchasing from the street. A major challenge is that we're trying to mount an emergency response for overdose on the backs of a non-existent substance use system of care.
Dr. Kendall says the challenges of a prescription-based model include the high criteria for access and doctors who are still too reluctant to give people these drug substitutes.
Clearly giving people safer drugs to take them, wean them away from an illegal drug supply is ethically appropriate. But the challenge is actually finding enough physicians or clinics who are willing to do this.
In Vancouver, Kier Junos, City News.
The group Mom Stop the Harm says it's happy to see recommendations from the Chief Coroner's Office, but if the government continues to drag its feet, the situation will only get worse. They support providing a safe supply of street drugs and say the province's approach isn't helping.
What they're doing is not working, and it will not work until they listen closely to people who use drugs, to the people with lived and living experience on what they need to move away from the illicit drug market.
McBain says the public's perception is changing around people who use drugs because it's hard to ignore how many people are dying. But she says the government is behind and still worried about the stigma around safe supply.